Hello, I'm Dr. Andrew Gutwein, the Program Director for the Internal Medicine Residency at Jacobi Medical Center at the Albert Einstein College of Medicine. We all know that applying for residency is a stressful time, and I hope this video will help guide applicants. When applying to internal medicine residency, you'll want to consider first where the residency is located. I suggest generally picking inner city locations because you tend to get more autonomy and have a broader clinical exposure. Also, try to go where you have a support network, since residency is an intense and difficult time and you need to consider your mental health. Many IMGs and a few AMGs need a visa. You may need to be flexible about the J1 versus H1B choice. There are pathways to staying in the US, if that's your ultimate goal, from each visa. It is easier to stay in the US from an H1B by directly applying for a green card, but there are less residencies and much fewer subspecialty fellowships willing to sponsor the H1B visa, usually due to cost. If your ultimate goal after internal medicine residency is a fellowship, you will want to consider not just what fellowships are directly associated with a given residency in their home institution, but where that program is able to get people into around the country. Now let's talk about the various aspects of the ERAS application itself. The USMLE steps are the most important part because they are frequently filtered by program directors to slim the number of applicants who apply to a more reasonable number to look through. You should do thousands of practice questions and multiple practice tests before taking each step. You should go into the test well rested with no recent psychological distress. If that's not possible, then reschedule the test for a later date. Once you have a failure or a low score, it'll mark you for life. You need to rock it on the first try. Now that step 1 is pass-fail, though, there is less pressure, though it will likely still be reported how many attempts it took to pass. Step 2 is the most important score. You will be much more likely to get into an internal medicine residency with scores above 230. If you scored less than average on step 2, you may want to consider taking step 3, at least for the IMGs, before applying so that you can show an even better score if you think it's likely to happen. Step 2 CS is now defunct, and the OET has replaced it with the pathways that the ECFMG has laid out for IMG applicants. Your CV is also really key. Let's go over 5 different parts. Try to get and document on it at least 3 months of US clinical exposure for IMGs by doing hands-on externships or sub-internships. If this is not possible, in-person, inpatient, or outpatient observerships are the next best choice. If you do an observership, it looks better if it's from an academic institution rather than a private practice. This is because both the institution's name will carry more weight and the letter writers are more likely to know what to write. That will carry more weight as well. Next best would be virtual rotations as a backup plan. The second part is research experience. Try to get involved in several projects over time. It's better if they culminate in a poster or abstract, and even better if your name is on a paper. First author publications will certainly carry the most weight. If you can, always add the PMID number of the article to your CV. That way it's clear that it was published and in PubMed. Make sure it's clear if you had extra training, like a PhD or a master's, because these will carry weight as well. Also, if you've done a residency or part of one in another country for the IMGs, then take credit for that as it will look good on your resume. Fourth part is extracurriculars. These should each be added separately so that the program director can see what your other interests and work has involved, though these will not usually be as key unless they show significant leadership. Lastly, don't leave any lengthy gaps on your CV, anything more than a few months. If there is a necessary gap, then at least explain it during the personal statement. Which brings us to the personal statement, which of course is the most hated part of the application. It rarely helps you, but it can ruin you. Keep it simple by writing about why you're choosing this field and what you have to offer, and not just about some sick family member. Make sure you don't have typos, spelling errors, or grammatical errors. For the IMGs, if you're not a native English speaker, have it read by someone who is before submitting it. On to the letters of recommendation. Some program directors will say that these are the most important part. Some will say they don't trust them because they're all positive. Personally, I think they are very important. You really must have 3 and should have 4 if at all possible. They should, as much as possible, be from faculty in internal medicine. If not, then family medicine and psychiatry are probably the next best that I would suggest. Surgery and OB-GYN, I would say, are less useful since some of the surgical subspecialties look for different qualities than maybe an internal medicine residency might look for. Having said that, we know that not all of you have every option laid at your feet, and we consider all letters. It is better if the letters come from people who know what program directors are looking for, and faculty at institutions will know more than attendings in private practices. If you get a letter from a program director or an associate program director, that's the best, if, of course, it's a great letter. If your letter writers know someone in a leadership position in a residency, then have them email that person to advocate for you. Honestly, even if they don't know the person, but they feel really strongly about your skills, a cold advocacy email can go a long way as well to getting you an interview. You should give them the name and email of the program directors that you want it sent to make it easy for the letter writers to do this. All right, the transcript and MSPE. AMGs have this part easy. The medical schools will do it automatically on your behalf. The IMGs need to be on top of their schools to send them both ASAP. Some international schools will tell you they don't even have an MSPE, or what they used to be referred to as the dean's letter. You should then have them send a letterhead paper stating that they don't have an MSPE. Otherwise, your file might not get reviewed because the program directors may think it's an incomplete file. Many schools from India and Pakistan, some other areas as well, only send the hours worked on different rotations or some sort of overall sheet with a summary of your marks each year. We really need the detailed marks sheets by rotation. Make sure that's what your school sends, otherwise at least email it yourself to the programs of interest. Starting late 2021, ERAS will be having a supplemental application. It will include several areas that are supposed to give more information to the programs so that they see if you're the right fit. I personally think the key part that will be used extensively is the signaling. You will be able to signal a certain number of programs that you are highly interested in those programs. I believe the signal will make your file much more likely to get reviewed at that small subset of programs to which you send that signal. I highly suggest that you be reasonable and thoughtful about sending signals to the programs that you're really interested in based on what you read online and what your friends, family, and mentors have told you. You also need to be reasonable in picking programs that you might actually get into. Don't signal a program where their website says they use a step 2 cutoff of 230 when you have a 210. And don't signal a program that takes all AMG applicants if you're an IMG applicant. These signals are likely to be wasted. All right, some other odds and ends tips before we finish. If you're a weaker candidate but have a specific interest in a certain program, do an audition elective, either clinical or research, at that institution, because that can really go a long way in making a lasting impression that gets you that interview. You should get your entire application into ERAS by the date the program directors start reviewing them. But even if you still have one aspect pending, say one letter of recommendation, get everything else in anyway, and then send that final piece in as soon as it comes in. Don't call or email the program director. Only email the program coordinator if something significant has really changed in your application. Like say you finally got a green card even though you're needing a visa in the application. Another good reason to email is if you're not a native to that geographic area where the program is located, but you have a specific reason, like say a partner who lives in that area, and you really want to make sure the program knows that. Don't send incessant emails. It will only annoy the leadership and make it less likely for you to get an interview. You should look up facts about the program on their website before interviewing and ask more about the intangibles during the interview day itself. At the interview, assume everyone with whom you interact is grading you and act accordingly. Afterwards, send a thank you email to the interviewer and the program coordinator. Paper gets thrown out, but the emails last forever. If you don't get contacted by the program after the interview day, don't worry, that's normal. Post-interview day communication is being actively discouraged among program directors because it puts more pressure on the applicants and can be misleading. If you really want to, send an email to say the top 1 to 3 places on your rank list, saying that you're ranking them very highly, but don't lie and say you're ranking them all number 1. I personally suggest really only emailing the number 1 program in your list and saying so. I know how much you guys have gone through getting where you are now. Good luck with the match.